Welcome everyone to the second in our town hall series, Equity Starts with Access. My name is Jamie Bruni Miles, President and CEO of the YMCA of San Francisco and co-moderator for tonight's discussion. I want to start by thanking Dr. Nadine Burke-Harris. Dr. Burke-Harris, you have an essential perspective as you deeply understand our local community, and you also bring a statewide perspective now as our first California Surgeon General. We are honored that you bring these two perspectives together to discuss the impact of COVID-19 on youth in our community. As a community, we're facing two pandemics. COVID-19 struck as a visible enemy, responsible for more than 200,000 deaths in the US and loss of millions of jobs. Secondly, COVID-19 has heightened our collective awareness of racial inequities that existed for centuries. Both of these significantly impact our communities in ways that are hard to comprehend. Now more than ever, we are pressed to find innovative solutions that ensure our communities can thrive. When COVID-19 hit, the YMCA quickly adapted our programming to address the child care to essential workers and deepen the reach of our social services that target the most vulnerable populations. Today, months later, we're now providing spaces for young people to engage in school through our academic enrichment hubs, offer food pantries, mental health services, family support, and recently expanded our adult wellness services as allowed by the state and local governments. We are living in a time of uncertainty. We must come together as a community, collaborate, and find the best path forward. To that end, conversations like tonight allow us to extract meaning and insight to understand better the impact of 2020 on all of our lives. We launched the Equity Starts with Access Town Hall series to explore conversations with community leaders, elected officials, and decision makers. Our goal for these town halls is to create a space where our community can gather and think critically about and seek a deeper understanding of our current context to navigate the future together. Our first town hall focused on the future of education, and tonight we dive deeper into how we collectively navigate a COVID-19 world. We are honored to welcome Dr. Nadine Burke-Harris, our first California Surgeon General. In 2012, Dr. Burke-Harris founded the Center for Youth Wellness in the Bayview Hunters Point neighborhood, where she led the organization for 7 years. She developed the Center for Youth Wellness Adverse Childhood Experiences questionnaire and user guide as a screening tool and protocol for pediatric care providers. In February 2019, California Governor Gavin Newsom created the role of the state-level Surgeon General and chose Dr. Burke-Harris to fill this role, where she's tasked primarily with raising public awareness of childhood adversity. She's the author of The Deepest Well, Healing the Long-Term Effects of Childhood Adversity, and this just is a small list that scratches the surface on the many accomplishments of Dr. Burke-Harris, and thank you for your contributions to the field of public health. The Y work embeds us in community where we see firsthand the forces that inflict trauma on children and the dire consequences that result when toxic stress is sustained through an entire childhood. Tonight with Dr. Burke-Harris, we'll explore how we can mitigate the impact of trauma in our young people and communities. I also want to introduce my co-moderator, Dr. Gina Gregory-Burns, YMCA San Francisco board member and internal medicine specialist at Kaiser Permanente here in San Francisco. Dr. Gregory-Burns graduated with honors from Howard University College of Medicine. With more than 30 years of rich experience, she has helped Kaiser Permanente San Francisco Medical Center provide equitable healthcare to diverse communities. Our format for tonight is to ask Dr. Nadine Burke-Harris questions for 45 minutes and provide you an opportunity for questions for the last 15 minutes. To ask questions as an audience member, please enter them into the Q&A section. My questions will center on the impact of COVID-19 on youth work, and Dr. Gregory-Burns provides a healthcare community lens. Thank you, and let's get started. The first question tonight goes to Dr. Gregory-Burns.
Thank you. Dr. Burke-Harris, welcome. Thank you so much. It's been wonderful to have you here tonight. I have to tell you, you're one of my sheroes. Your journey and accomplishments are an inspiration to all of us, and certainly as a primary care physician who is out there trying to address social determinants of health and how that underlies the health disparities that we see every day. We really appreciate your efforts and your current role. And as Jamie was saying, my lens is going of the questions right now going to be through healthcare and the impact of the pandemic on the community. So my first question for you is, for those of us who may not be familiar in the audience, can you give an overview of your groundbreaking work on adverse childhood experiences, or ACEs, and how ACEs inform your work as California's first Surgeon General? And also, what kind of pressure has the pandemic put on your priorities?
Absolutely. Well, the first thing that I want to highlight is that the research and the work on ACEs has really been the collective work of many folks nationally and even around the world. But my introduction to it, my familiarity to it really came now over a decade ago when I was seeing patients in Bayview Hunters Point, which is one of San Francisco's most underserved neighborhoods. And I was doing what I was, trained to do, caring for kids in the community. And one of the experiences that I had was I was seeing these significant health disparities, right? And that was really my background coming to the work, was really in a health disparities lens. And I was seeing that an incredible rate number of kids were experiencing asthma. An incredible number of kids were being referred to me for difficulty with learning, often with a label or some recommendation saying, hey, this child has ADHD, please can you put them on some medication. And when I did what I was trained to do, which was do a thorough history and physical, what I started to notice, and this is, in part because my background also in public health, was that my patients who had the highest rates of ADHD learning difficulties were also my patients who, when I did the history part of my exam, I was hearing these stories of kids whose parents were experiencing untreated mental illness or substance dependence, or kids who were witnessing violence at home or in the community. But it wasn't just their behavior, it was also their health. Like I specifically remember I had one patient who I talk about sometimes. There was a 10-year-old girl who I was seeing for asthma. And we went through all of her asthma triggers and her asthma, I had put her on 2 rounds of really strong medication, oral steroids, to try to keep her out of the hospital. And when I sat down with her mom and I said, what are the asthma triggers that we're missing? Like what do you notice that could be associated? Because we've looked at, pet dander and all this other stuff. Mm-hmm. I'll never forget what her mom said to me. She said, doctora, I noticed that my daughter's asthma tends to act up when her dad punches a hole in the wall. And that for me really was one of those light bulb moments. And so I started looking into the science and the research of how is it that experience of adversity affect children's developing brains and bodies. And that was how I came across the landmark research that was done by Dr. Vincent Felitti at Kaiser Permanente and Dr. Robert Anda at the Centers for Disease Control and Prevention, which was, what is now the now famous Adverse Childhood Experiences study, which showed us a couple things that were really powerful. Number one, adverse childhood experiences are incredibly common. When that Kaiser CDC study was done over 20 years ago now, they found that 2/3 of their population had experienced at least one adverse childhood experience, and 1 in 8 folks had experienced 4 or more. Across the state of California, we now track that data, and we see that roughly 17% of Californians have experienced 4 or more of the traditional ACE criteria. And those include, physical, emotional, or sexual abuse, physical or emotional neglect, or growing up in a household where a parent was mentally ill, substance dependent, incarcerated, where there was parental separation or divorce, or domestic violence. And when I go through those criteria, right, immediately what might come to mind is a recognition that the pandemic is making all of those things worse. Yeah. We're seeing intimate partner violence rising. We're seeing substance use and dependence rising. We're seeing mental health concerns rising. With child maltreatment, abuse and neglect, what's really terrifying is that those reports have cut in half, right? From the time that we did shelter in place, we saw a 50% decline statewide in reports of child maltreatment because children are no longer coming into contact with the safe, nurturing adults who would who would be attuned to understand if there's something going on and make those reports if they were necessary. So we really see these impacts, these risk factors going up substantially statewide. And in terms of how that's impacted our work, well, the entire state has been mobilized in the response to COVID-19. But one of the things that I think was really telling is that our statewide initiative to train healthcare providers on how to screen for ACEs and how to respond with trauma-informed care is something that has continued to be a major priority, because we recognize that now is not the time to, pump the brakes when it comes to identifying adversity. In fact, we have more kids, more families that are really experiencing the severe adversity, and our ability to recognize that is actually a critical part of our COVID response.
Thank you. And that's perfect. It goes right to our next question, that you recently helped launch ACEs Aware, the California state program which funds Medi-Cal providers to conduct ACE screenings for children and adults. Training in ACEs is now a new requirement for licensed healthcare providers to learn about the effects of toxic stress, and over 14,000 providers have already been trained across the state. I took it this summer, and actually I found it very helpful, and the clinical scenarios were wonderful because they also gave a way that I could verbalize back at our facilities, like, well, this is the scenario that I remember, and this really reflected what I see. And we do need to think differently when, for instance, a patient is failing to keep a certain procedure, not following through with a recommendation. There may be deeper issues that are in play. So the scenarios were great. So given that, the question that I have are people who have high ACE scores more vulnerable to long-term effects from the stress of the pandemic?
The short answer is yes. So one of the things that the science tells us is that the way that ACEs affect us biologically, the way they get under our skin, is that when we are exposed to high doses of adversity, and especially during the critical time of childhood, right? This is a time when our brains and bodies are just developing, that it can actually affect the way that our bodies are wired to respond to stress in the future. And what that means, one of the things that we see is that individuals who have experienced high doses of adversity in childhood may become what we call stress sensitized, meaning that, so we know that folks will have increased risk of having a negative health outcome, right? Both short-term outcomes in terms of increased risk of infection, increased risk of things like asthma and diabetes, but also increased risk of long-term health outcomes like heart disease, stroke, cardiovascular disease, even Alzheimer's. Well, one of the interesting things is that biological process and the sensitization of the body, even for folks who, for example, maybe didn't have one of these, an adverse health outcome, because the impact of adversity is cumulative, right? It may be that a major stressor that you experience later on down the line can be essentially like a second hit that can make individuals who are sensitized then tip over into having negative outcomes, a negative health outcome. So that is exactly what we see. And something like the pandemic dramatically increases the risk of having negative health outcomes, not only because of increasing ACEs and other stressors like economic hardship, right? But it also reduces access to one of the most important interventions for buffering the effect of stress, which is safe, stable, and nurturing relationships. And so we have this pandemic, which is a stressor. It causes economic stressors. It causes all kinds of other stressors. But then on top of it, the way that we're wired to protect, to buffer that stress response is through these nurturing relationships. And we're not able to do that as much right now. So that it makes it even more difficult.
Wonderful. Thank you.
So let's ask that question. Let's unpack that a little bit more. So from a youth perspective, youth worker perspective, from a parent perspective, you talk about the sustained adversity that children are going through in the last 7 months. And the study came out in September 2020, that 59% of social workers report that the pandemic is compounding child abuse and neglect. And you just talked about that. So from a parent perspective, a youth service organization, how do we mitigate the impact of trauma on children that is so profound, so consistent, and 10, 15 years ago, based on your research, will show up in their health disparities over time? What can we do as a community and healthcare providers and parents during this time?
Yes. So step one in what we can do as a community of providers, and I'm talking to parents especially right now. So one of the most important things that we can do is, this is going to sound counterintuitive, is to put our own oxygen masks on. Self-care is not selfish. And I'm saying this now as a mom of 4 boys, right?
Bless you.
What we're all experiencing. So here's the thing. Kids, in order for kids to feel safe and make meaning and really make it through this time, one of the most important things is that they cue off of us. They cue off of how we're doing. There's something that I've learned from my mental health colleagues called co-regulation, which is that when we are calm and balanced and well-regulated, that the kids in our care cue off of that, and they really take a page from that. So one of the things that's that's really important. But the other piece of that is also to recognize, oh, the lights went out of my office because I'm here so late. The other piece of that is like I said, safe, stable, and nurturing relationships and environments right now are absolutely critical for children's healthy development and for their resilience during the pandemic. And so what that means is that if you are if you're a parent, that means, doing, checking in, cueing in on how your kids are doing, taking that time to recognize that, things may not work perfectly right now. We may not get as much stuff done as we usually do. Things may not work exactly the way that we had hoped, but the priority is really tuning in and cueing in to the young folks in our lives. And if you're a provider, someone, an educator, someone who's caring for or providing services for kids, now is the time to be reaching out, checking in, being available, making sure that if we can't reach kids in person, that we can find ways for either to connect with them or allow them to connect with us digitally, online, Zoom, text, chat, whatever it is that, technology enabled ways that we can do that, and really help to reinforce for kids like, hey, if this feels hard, it's because it's hard. It's okay to not feel great all the time. And it's okay to talk about how you're feeling, to talk about what's going on with you. And one of the things that we did in the Office of the Surgeon General, we actually created the California Surgeon General's Playbook for stress relief during COVID-19. And we really took a bunch of evidence-based approaches, and we have this both for individuals and also for kids and caregivers. Things like, sticking to our routines, right? Going to bed and waking up at the same time, even though we're doing, distance learning and we're not going out of the house to go to school. or things like how important, even though all you want to do is dive to the bottom of a pint of Haagen-Dazs or a bag of Doritos, how nutrition actually helps to balance our mood right now. And that, having a good, healthy, nutritious diet is important. Or like daily exercise is key to help regulate the stress response, make all those good, healthy brain hormones and all of those types of things. So, I talk about sleep, exercise, nutrition, mindfulness, like meditation, mental health supports, and healthy relationships are really the key pillars of helping to build resilience during this really stressful time.
May I ask, that's on your website?
That is on the covid19.ca.gov website.
Perfect. Thank you.
That was a question. How do we access these resources so we can share it among our community? Is that the website?
Yeah, absolutely. Go to covid19.ca.gov. There's a heal page, and there's access to the Surgeon General's website, which is also downloadable in I think it's 14 languages. So it's really as well. We have resources for CalHope, which is mental health, access to mental health services through our Department of Healthcare Services. So we have a whole, bunch of resources for folks.
I'm going to ask one more question, then turn it back to Dr. Gregory Burns. So I want to ask you to go back to your younger self. That's a couple of years from now. You wrote this incredible book, and if you don't know, it is like almost the book to read for healthcare providers and youth care workers. I remember at a meeting when it first came out, I was at a table, and one of our coworkers, Cliff Mango, was next to me, just an employee of ours, phenomenal, and he had the book. And then in the room, the entire table had the book, and of course, I had to read it. So my question to you is, go back to your younger self. Now we're in this 2020, these pandemics, racism, systemic, all that stuff going on. What extra chapter would you write right now if you went back to your younger self?
Oh, wow. What a fantastic question. I'll tell you the chapter that I would write right now. So in the book, I talk a lot about, I talk about what are ACEs, what is toxic stress, how does it, impact kids and health and, health over the life course. And I talk a little bit, and I give a couple examples about how this can show up and what this looks like in, for example, an educational setting, or how, what this looks like I give actually an example among, wealthier communities, like just a whole cross section. And I think one of the experiences that I had on my book tour, actually, so this really is like a time machine moment, was when I would go on the book tour, and I would be speaking to an auditorium full of folks, and it would be a panel usually. And I'd be, talking in conversation with other professionals, and there would be a police chief and a superintendent of public education and a healthcare leader. And each person would say, like the educator would say, you know what, this is a big issue for us. This is something that we're dealing with. But as educators, how can we screen for toxic stress, or how can we screen for ACEs? And then the healthcare professional would say, listen, I can screen for ACEs, but I see a kid a couple times a year at most, right? And what was really, where I think there's a deep opportunity right now is those points of interconnection, right? So we don't need to reinvent the wheel. Educators don't need to screen for ACEs. We can do that in the primary care home, and we can rely on our educators to provide the daily doses of nurturing, buffering, caring relationships that really are the antidote to toxic stress, right? This is the work that happens in our educational settings, in our community settings, that all of our community-based organizations are doing every day. And some of the questions is, how do we do that? So as you're saying this, you know, if I were to write it again, we're actually just about to release the California Surgeon General's, the first Surgeon General's report on ACEs and toxic stress. And one of the things that we highlight in the report that'll be coming out next month are examples of those intersections. For example, there are, there's an initiative called Handle with Care. It was pioneered in West Virginia. Several counties in California have adopted it. And what it allows is that if there's a first responder who shows up on a scene, and whether it's a police officer showing up on a call for domestic violence, or a meth lab blows up, or, you know, there's a car accident. And what it allows that first responder to do is, if there is a child on scene, get their information and send a secure message with no private information that simply says, this child was on scene at a traumatic incident yesterday, right? And so what that does is that allows, and it sends the message to the child's school, where the child's school then knows that for that child, they need to handle with care. So if that child is spaced out or acting out or falling out, right? That they recognize, no, this child is actually having a reaction to a normal reaction to what they experience. Mm-hmm. And that is really the change in the frame, because what we've seen, and let's like overlay this, when we look at this, the evidence, and we see the data on the number of kids who are being expelled from preschool, right? Mm-hmm. And some of the national data that show that the rate of expulsion from preschool is 5 times higher for Black boys, right, than it is for whites. And you start to take what is a normal biological response to something traumatic, and then you overlay that with a lens of, you know, racism and what happens in our society. Programs like Handle with Care, mm-hmm. for every child who experiences a traumatic situation, instead of going to school and being kicked out or punished or being asked what's wrong with you, they get asked, you know, or maybe they don't get asked specifically about the details, but they can get an approach of what happened to you, mm-hmm. and how can we be part of a healing environment. Mm-hmm. That type of thing is transformative. And those details around the interconnection, how do we, you know, connect these pieces of the work, I think is the next phase of this work.
Wonderful, thank you. Well, that transitions into our next question. And actually the next question is regarding racism and the impact of racism and COVID-19. So the murders of George Floyd, Breonna Taylor, Ahmaud Arbery, and unfortunately a continuing list of traumas in the African-American community, in addition to the health disparities highlighted by the COVID-19 pandemic, have brought the effects of systemic racism into the forefront of national discourse. And the history of racial discrimination in this country, as evidenced in housing, education, employment, access to quality health care, has yielded a higher incidence of chronic illness, as you've mentioned, including asthma, diabetes, hypertension, cardiovascular disease, kidney disease, and mental illness in all communities of color. And COVID-19 has a greater impact on people with these chronic diseases, and certainly as it does with frontline workers due to increased exposure. There are higher rates of infection and of death with COVID-19 in our African American community, Asian American community, and Latino population as well. So the question that I have for you, which is a two-part question, how has the collision of the COVID-19 pandemic, racial injustice, economic and political chaos increased that stress? And certainly, how does it affect the policy decisions that you're making now?
Okay.
Oh.
I will answer the second question first.
Oh.
Well, you know, what I will say with this is yes and yes. We are in the middle of, you know, a once in 100 years pandemic, a once in 75 years economic downturn and a once in 50 years social movement to address racial inequities. And I think that I will say that this I have to take a moment there when I say that, because it just is so powerful. Like, you can say it and it comes off the tongue, but like taking a moment to say, to just think about what we are all going through right now, and especially our communities of color.
Mhm.
And one of the things that I'm really proud of is that with the ACEs Aware initiative, one of the things that we've highlighted and that we're actually doubling down on is a recognition that while the original 10 ACEs, they are extremely useful for having very standardized risk ratios with health outcomes, right? Now that we understand that the mechanism by which ACEs lead to these negative health outcomes is through this biology of toxic stress, the prolonged activation of the biological stress response, and how that affects our brains and bodies, how it affects our immune system and our hormonal system, and increases the risk of health conditions. So what we see is that racism not only increases the cumulative burden of ACEs for certain populations, right? So we see nationally, when we look, that African Americans and Latinos have the highest burden of adverse childhood experiences of when we look at across groups, right? But at the same time, we also recognize that racism, and it also limits the access to the resources, the community investments, the access to high quality resources that would be a buffer.
Mhm.
And racism itself is a risk factor for toxic stress, right? I will say that I think anyone who watched the George Floyd video reacted in absolute horror. But I know that when my teenage boys looked at that video, they saw themselves,
Mhm.
right? And that activation of that threat response is real. And that, again, is part of what is increasing the risk. And so one of the things that I'm really proud of is that as part of the ACEs Aware initiative, aside from the fact that in general, where we talk about the importance of recognizing ACEs, the importance of recognizing toxic stress and responding with trauma-informed care, one of the things I think is really critical is that when we, in order to get to equity, trauma-informed care is an essential, a fundamental aspect of driving towards equity, because racism and inequities are inherently traumatic,
Mhm.
right? And so being able to strengthen our statewide capacity for trauma-informed care is something that's really just absolutely critical. But the other thing, the thing that I'm really proud of, is that here in California, we are the first and only state to create an equity metric and have that be part of our reopening blueprint, right? To say, we know that the pandemic is exacerbating inequities. And so we in California are going to be intentional about ensuring that our reopening does the opposite, right? That we are specifically targeting equity as one of our key metrics for reopening. The only state in the nation to do it. And it's something that I'm really proud of, because what that does is it aligns, it gets all of us behind this idea to say that it's a benefit to all of us, every single one of us. We all want to recover and reopen from the pandemic. And so investing in equity is something that it's in all of our interests. And that just feels so powerful and important that California has taken that very important stand.
Thank you so much.
You brought up something I want to, it's a new question, but it's an important question because you brought it up. And you talked about your son and the impact of the George Floyd in the video. And we're an employer of healthcare workers, racially diverse. So they come to work every day and dealing with the pandemic, systemic racism, and being there on behalf of the youth they serve. As an employer for the population that can't walk away from this because they have to go to work every day, what do you recommend that we do to give some space and self-care for our employees who cannot take a break from this because they've got to take care of the youth we serve every day? Any thoughts on that from the youth care perspective, equity perspective, and specifically Black African-American staff of color who cannot go home from this at all? Any thoughts on that, on what we can do as employers or as a state can do to help us?
Sorry, can you say that again in terms of who can't take a break from this? Can you clarify what you mean?
Son, an example of your son and the video of it and the traumatic of watching the murder of George Floyd.
Mm-hmm.
So we are an employer of staff of color who are youth workers every day, and they can't walk away from it because they need to be back to take care of the youth they serve. Any recommendations from a state perspective, healthcare perspective, mental awareness, what can we do as an employer in this period of time for our staff of color who are every day dealing with the impacts of racism and COVID-19?
Yeah. So I think that one of the crucial aspects, and it's something that we talk about in the ACEs Aware training for our healthcare providers, is the importance of recognizing vicarious trauma and how that contributes to, if you want to call it burnout, but it's more in terms of, how that affects our well-being. And I think it's absolutely critical, whether you're in healthcare, whether you're an essential worker, whether you're any kind of frontline provider, it's critical for us to have capacity, resources, and space for our teams, for our staff, to be able to do that self-care, to be able to acknowledge and recognize and implement wellness as a key part of the work that we're doing. Listen, we recognize that our staff, our teams, they can't go back to work without PPE, right? Personal protective equipment. Supporting the well-being of our staff, to supporting their resilience, their well-being, preventing vicarious trauma, right, is very much along those same lines of how we protect the health and well-being of our teams during this time. And so that is, we have some, we certainly have some best practices that we're sharing through the ACEs Aware initiative of how to do that from in a healthcare setting, but and I can follow up with you around resources to do that for our frontline providers. I know that we have these resources. We have them for in the educational setting, and it's really around making sure that our teams really see and hear that as a priority, right? And then have the resources to be able to do that.
Great. I have one final question before we go into the audience, and it's around CalHope. And as we've heard from parents ahead of this, and this is the question that was asked that I'm going to bring first before we go to their questions. How do we receive how do we actually receive and get some answers specific to our personal experiences? So how can individuals receive support to help them navigate? And we've heard CalHope, it's a new hotline initiative. Can you talk about it a little bit from, I'm in my home, I need someone to talk to, How is Cal Hope going to provide that opportunity for parents? Can you talk about a little bit more?
Yeah, absolutely. So Cal Hope is an initiative from the Department of Healthcare Services. And one of the wonderful things that they have is the Cal Hope Warm Line. And the reason that it's a warm line and not, not called the hotline is because we specifically, the focus is to be able to get resources, to be able to reach out to and connect with someone with lived experience, right? And on the Cal Hope Warm Line, it's an opportunity to speak with someone who's had lived experience, who can guide you through the process, who can connect you to resources. And it's like, don't wait until it's hot. Like, don't wait until the wheels have fallen off the cart. You can reach out and get these resources. And yeah, so the Cal Hope Warm Line is, I wish I don't have the number right in front of me, but we can send that out and follow up with you guys on the Cal Hope Warm Line to help families just get access to resources that they might need.
Thank you.
Oh, that's wonderful.
So the first question, we're going to go to the audience. Jeannie, you want to take the first question from the audience?
All right, let me go over here. All right. Thank you for hosting this meeting. I'm interested in viewing the documentary, Resilience, the Science of Toxic Stress. How can we make this film accessible to all of our communities? Can we watch it through YouTube?
That is a wonderful question. So the documentary was produced by KPJR Films, and I know that they have they've had a number of viewing events, and I think they're planning to actually have another wide scale screening. I think the best way to get the information from KPJR is either to, oh, you know what? You can just go to their website. You can just go to their website and request to be able to host a screening, and they'll help you through their website. So I think it's kpjrfilms.org. But if you Google KPJR Films, it'll come up.
Thank you.
Great film. It's worth the watch.
It's amazing. And I just have to say one word that the director of the film Resilience and the companion film Paper Tigers, which really addressed trauma and adversity in the school setting, is a dear friend of mine. James Redford just very recently passed away, and it was just such a heartbreak. But his work has resonated around the world, and it's really remarkable. They're remarkable films. I really highly recommend them.
He's a friend to the Y as well, and was working with us on documentaries in the past. So yes, his passing was hard for all of us. I'm going to go to the next question. Can you please speak to the adverse impact of screen time and give advice about engaging in interpersonal relationships in and after school in extracurricular context in this time of distance learning? Asking kids to do one more Zoom seems to be contributing to toxic stress.
Well, I will say, in terms of the relationship between screen time and toxic stress, I can't comment on that because we would, I haven't seen the literature on whether or not screen time contributes to toxic stress. But we do know that having in-person relationships and connection is really, really powerful. That being said, I want to flag something, right? Again, I will say that as a parent of 4 boys, the focus is on, I think it really makes sense to think of the focus on what we want to do more of, what we know is enriching, what we know is really healing, which is those in-person relationships and connections. That being said, I'm trying to not do any kind of blaming or shaming around any, for any of us whose kids may be having a little bit more screen time. That is typically what would happen, because we gotta cut ourselves a break right now during the pandemic. right? Not everything's going to be perfect. But what we do know is there's no substitute for those in-person connections. And so trying to double down on those, doing as much as we can do safely, and making sure that we're following public health guidelines is really critical.
Thank you.
Okay. The next question. How are we measuring the increase in domestic violence and abuse cases if the number of reports are decreasing?
Yeah, so those reports happen differently. So when we talk about the reports that are decreasing, those are the reports of child maltreatment. And what we see is that a large number of reports for child maltreatment are made by educational personnel or child care personnel, right? And so now that we've gone to distance learning, we have fewer kids in school, then that's kind of part of why we've seen this dramatic decline. In terms of intimate partner violence, the number of reports that either through police reports or calls to domestic violence hotlines, those we see going up. And so those we're actually looking at the actual number of reports.
Thank you.
All right, next question. Can you give an example of how the equity metric works in affecting how California's reopening is structured and implemented?
Oh, that is a great question. So the way that the equity metric works is that it uses a very well validated instrument called the Healthy Places Index. And what the Healthy Places Index looks at is it includes a number of factors, including income, and access to transportation, a number of social determinants of health that is in that Healthy Places Index. And it compares for each county the group that is at the lowest Healthy Places Index versus the group that is at the highest. And what we look at is what is the test positivity rate in that lowest group versus the highest group. And what we are looking to see is that those counties are making steady progress at reducing that disparity between those groups. And so that is how we're implementing it. And what we see is that as we have our yellow, orange, red, purple tier system of opening, we are including the equity metric in the consideration of the ability of a county to move from, for example, orange to yellow.
Okay. Do the Bay Area Ys each have their own standards and methodology for optimal air ventilation?
We do.
Okay.
I'm going to save that for a different conversation. I would love to answer that elsewhere. And if we can keep the Dr. Nadine Burke-Harris's.
Okay. All right. Thank you. And another question. What interventions do you recommend for children who have been exposed to extreme ACEs? So not, the usual list, maybe 2 out of the 8, but when you have extreme exposure.
Yeah, so there are a number of evidence-based intervention, and it depends on the age of the child and developmental stage. For example, one of the very effective interventions that I've seen for kids who are under 6 is something called child-parent psychotherapy. It's a really excellent intervention, and it's something called a Diatic Therapy, which means that the therapist works with both the parent and the child at the same time. And they address the parent's history of adversity, because most often when you see a child who has high ACEs, most often their parent also has their own ACEs. And so in order to be able to create that safe, stable, and nurturing relationship and environment for that child, you really have to be able to work on two levels. For kids who are a little older, so starting around age 6, in my former life as a clinician, we used a number of interventions. So, I talked previously about sleep, exercise, nutrition, mindfulness, mental health, and healthy relationships. Those are really the foundational pieces. And we would work very much on things like making sure the child is getting regular exercise and some of those other pieces. And getting access to high quality evidence-based, for example, mental health interventions. Another intervention we used in my clinical practice was something called neurofeedback. And that was actually a ton of fun. The kids love it. And it's when you put EEG, so the electrodes on a child's scalp, and it measures their brain waves. And then the child gets to essentially play a video game on a computer. Oh, there goes my lighting again. A video game on a computer, controlling it with their brain. And what they actually have to do is, we know that part of the prolonged stress response, so the stress response is something we call our sympathetic nervous system response, and that the brain, the part of our nervous system that counteracts that sympathetic or fight or flight system is something called the parasympathetic nervous system, which is for resting and digesting. And we actually would have kids practice interventions that would help to kind of calm their brains down, and it would activate the parasympathetic nervous system. And when they did that, they would control a video game on the computer screen. Wow. And kids loved it. They would come in and be like, can I play the game? Can I play the game? They love playing the game. And it was that was something that was really joyful and really actually, we saw some good effectiveness was neurofeedback, and the neurofeedback is combined with therapy to help the child be able to understand, make meaning, develop coping strategies, identify what was going on with them. And then it was really about creating these spaces of safety and helping to train their brains to respond, to turn off the fight or flight response and turn on that resting and safety response.
That sounds like something that should be widely available.
You could use that. I'm going to do one final question, and we'll wrap it up for the evening. And I think this is a great question. Well, they're all great questions. As someone pursuing a career in pediatric medicine, I really appreciate how many takeaways you've given me on what needs to change at a systemic level on the delivery of healthcare. What do you think is the most important for a provider to do on an individual level to take on a trauma-informed lens?
Oh, that's a really great question. Well, you can start by going to acesaware.org and taking the training, becoming ACEs Aware in California. I think it's a really fantastic foundation. I think that learning about the science of the toxic stress response, I think, one of the things that's really common, people talk about toxic stress and they think about it in terms of like, they're often referring to the stressor as the toxic stress. When we recognize that toxic stress is actually like, the science is really strong. And we've identified that it actually represents a health condition, right? This prolonged activation of the stress response that really affects our health. And one of the things that I think is really critical, I remember walking to when Bayview finally got a Starbucks, right? Which was in 2016. I was walking to the Starbucks and someone from the community came to me and she stopped me and she said, Dr. Burke, I want to know, can you be my doctor? And I said, I'm sorry, I'm a pediatrician, And she said, well, here's the problem. I went to my doctor and I talked to my doctor about ACEs. My doctor doesn't know what I'm talking about. And she said, I have 10 out of 10 ACEs. In fact, my family is 10 times 10. Everyone in my family has 10 ACEs, right? And so I think that there are so many layers to the work that we have to do. Each individual clinician understanding the science of toxic stress and understanding the effective interventions, because one of the biggest obstacles to implementing this work broadly is the myth, right? The false belief that there is no treatment for toxic stress, that there is nothing that we can do about it, and that when you identify ACEs, there's nothing that you can do. And that is frankly false. The research and the science shows us that there are strategies that will help to regulate the biological stress response and help to improve health outcomes. That is well documented. And so I think that piece is really important, really, as a clinician, understanding what we can do.
Mhm.
And then beyond that, moving towards within your institution, raising awareness, training for everyone. What I've been amazed by is the power of each of us as individuals. If we are a champion within our institution, if we are a champion across our organization, to be able to really advance this work and really create the future that is the future that's going to heal, right? We have the power to make it manifest. And it starts at the individual level and it goes all the way to getting involved in policy. And oh, by the way, next Tuesday, vote, right? Like all of the above. Really, really lots of ways to get involved and be part of advancing a trauma-informed system of care.
Well, last question is to you again, but specifically, what have we missed? How would you want to wrap it up and tell the audience, as the Surgeon General, our first and best Surgeon General, what do we need to hear? What have we missed? What would you like to add in our last kind of question to you?
I think if there's a few things that I can leave people with, number one is that self-care isn't selfish. I want to reiterate that, especially right now that we are going through all of this with the pandemic, systemic racism, all of the stress around the election. There's a lot on our plates right now, and that really is fundamental. It's so critical. I think the second piece is that we are powerful, and whether it is in the context of we have the power to create healing relationships in the lives of the people around us, right? Or we have the power to shape our future by exercising our right to vote, or we have the power to shape a future of trauma-informed care by doing the work in our daily lives and spreading the word and shouting it from the rooftops. I think those are some of the pieces that I feel are absolutely critical. But the other piece about it is, as California's first Surgeon General, I set a bold goal to cut ACEs and toxic stress in half in a generation. And while that sounds incredibly ambitious, and I think that we're actually on our way there. It's incredibly exciting what we've been able to implement so far. I want to remind folks that a generation is 20 years. That's a long time. And we need you in this fight. We need you. And so we may not get it all done today or tomorrow or this month or this year. But if we keep making that steady progress, we will get it done. And when that 20 years comes, when we've passed a generation and we turn around and look at what we've accomplished, I hope to be able to come back and visit with you again and be in conversation again and look and say, wow, this is what we did, and we did it together.
Thank you.
Wonderful. Thank you so much.
You want to wrap us up, Dr. Gregory Burns?
Well, I have to say, this has been so inspiring with all these dark times around us. Just listening to you and your enthusiasm and your advocacy is just amazing. And, as a physician, when we talk about health disparities and all the things we need to do to address them, and what you're saying, resonates with me so much. Is like, if we could just wrap our hands around toxic stress, that would just help us cut so much of that, what we talk about. So thank you for all of your wonderful words and enthusiasm and kind of joy, quite frankly. And we appreciate this and also look forward to collaboration in the future. So thank you so much.
Thank you.
Oh, it's my
Good
pleasure.
night.
Okay. Thank you, everyone, for joining us this evening.
Thank you,
And
everyone.
thank you for all your great chats. There are lots of great questions.